the pandemic that stopped the world. Imagine a disease so contagious, so deadly, that it forced the entire planet to shut down. Cities locked their doors, economies collapsed, hospitals overflowed, and millions died. It wasn't a war. It wasn't a natural disaster. It was a virus, a microscopic enemy that brought humanity to its knees. In just 3 years, COVID-19 killed over 7 million people officially, but the real number might be closer to 20 million. It erased trillions of dollars from the global economy. It changed how we work, live, and interact with each other. But what if it never happened? What if that virus had never jumped from animals to humans? What if the world had never experienced lockdowns, mask mandates, and vaccine debates? How different would our lives be today? This is the story of the deadliest pandemic in a century, and the alternate world where it never existed. Let's explore what happened and what could have been the beginning. Wuhan, December 2019. In late 2019, doctors in Wuhan, China began seeing patients with a mysterious pneumonia-like illness. The symptoms were severe fever, shortness of breath, and in some cases, death. Initial cases were linked to the Wuhan seafood wholesale market, where live animals were sold. Chinese authorities notified the World Health Organization on December 31st, 2019. But at first, no one knew how serious this would become. By January 2020, scientists identified the cause, a new coronavirus. Later named SARS-CoV-2, the disease it caused was called COVID-19, short for coronavirus disease. 2019. This wasn't the first coronavirus outbreak. SARS in 2003 and MERS in 2012 had killed hundreds, but COVID-19 was different. It spread faster, it was more contagious, and crucially infected. People could spread it before showing symptoms by mid-January. The first case appeared in the United States. A man who had traveled from Wuhan to Washington State within weeks, COVID-19 was detected in Europe, South Korea, Iran, and dozens of other countries. The world was facing a pandemic, but governments were slow to react. The world shuts down. March 2020, on March 11, 2020, the World Health Organization officially declared COVID-19 a pandemic. At that point, there were 118,000 cases in 114 countries and over 4,000 deaths. Governments panicked. Italy, one of the first European countries, hit hard, went into complete lockdown. Hospitals were overwhelmed. Doctors had to choose who would get ventilators and who would be left to die on March 13th. The United States declared a national emergency. President Trump banned travel from Europe. Schools closed, businesses shut down, and panic buying emptied supermarkets, shelves of toilet paper, hand sanitizer, and food. By late March, most of the world was in lockdown. California issued a statewide stay-at-home order. New York City, the epicenter of the U.S. outbreak, closed its schools, affecting over 1 million students. Restaurants, bars, gyms, and non-essential businesses were ordered to close. Streets that were once crowded became empty. Airports turned into ghost towns. The global economy ground to a halt. Economic devastation. The Great Lockdown. The economic impact was immediate and catastrophic. In April 2020, the United States lost 20 million jobs in a single month. The unemployment rate hit 14.7%, the highest since the Great Depression. People couldn't pay rent, businesses went bankrupt, and governments scrambled to provide relief. The U.S. passed the CARES Act, providing 1,200 stimulus checks to adults, expanded unemployment benefits, and loans to businesses. The total cost was over $2 trillion globally. The economic damage was estimated at $16 trillion in the U.S. alone. Stock markets crashed in March 2020 before recovering as governments pumped money into the economy. But the damage was done. Supply chains broke down, factories closed, and international trade plummeted. Airlines lost billions as travel bans remained in place. tourism industries in countries like Spain, Italy, and Thailand collapsed. Millions of small businesses closed permanently. Entire industries, hospitality, entertainment, and retail, were devastated. Workers in these sectors, many of them low-income minorities, bore the brunt of the crisis in Chicago. For example, Black residents made up 30% of the population, but accounted for 68% of COVID-19 deaths. They were 6 times more likely to die than white residents. This pattern repeated across the United States and the world. The pandemic didn't just kill it, exposed and worsened inequality. The death toll, humanity's darkest hours as the virus spread unchecked in early 2020. The death toll climbed. By April, the United States had the most confirmed cases, and deaths surpassing Italy and Spain. Hospitals ran out of beds, ventilators and protective equipment for doctors and nurses, healthcare workers, exhausted and traumatized, worked 16-hour shifts watching patients die alone because families couldn't visit. Morgues overflowed. Refrigerated trucks were brought in to store bodies. New York City, the hardest-hit U.S. city, saw over 800 deaths per day. At the peak, mass graves were dug on Hart Island to bury the unclaimed dead. By May 2020, the U.S. had surpassed 100,000 COVID-19 deaths. Just 4 months after the first case globally, deaths reached 1 million by September 2020 and continued to climb. The virus didn't discriminate, but it hit the elderly and those with pre-existing conditions hardest. Nursing homes became death traps, with entire facilities wiped out. Families couldn't say goodbye. Funerals were banned or limited to just a few people. Grief and isolation became defining features of the pandemic. The vaccine race, hope on the horizon. As the death toll mounted, scientists raced to develop a vaccine. Normally, vaccines take years to develop, but COVID-19 vaccines were created in record time in December 2020. Just 1 year after the virus emerged, the FDA granted emergency use authorization to the Pfizer-BioNTech vaccine on December 14th. Sandra Lindsay, a nurse in New York, became the first American to receive the vaccine a week later. Moderna's vaccine was also authorized. Governments launched massive vaccination campaigns by mid-2021. Over 100 million doses had been administered in the U.S. Vaccines proved highly effective, reducing severe illness, hospitalization, and death by over 90%. But distribution was unequal. Wealthy countries hoarded vaccines while poorer nations struggled to get doses. Vaccine hesitancy also became a problem. Misinformation spread online, and millions refused to get vaccinated for political, ideological, or fear-based reasons. This prolonged the pandemic and allowed new variants to emerge, variants and the endless battle. Delta, Omicron, and beyond. As the virus spread, it mutated, creating new variants. The Delta variant, first identified in India in late 2020, was more contagious and more deadly than the original strain. It caused a surge in cases in mid-2021. Even in highly vaccinated countries, then came Omicron. In late 2021, even more transmissible, but generally causing milder illness. Omicron spread faster than any previous variant, leading to record case numbers, but fewer deaths thanks to vaccines. Each new variant brought renewed fear. Lockdowns returned in some places. Mask mandates were reinstated, and the cycle continued. Governments struggled to balance public health with economic recovery. By 2022, most countries had shifted from elimination strategies to living with the virus. Vaccines, boosters, and treatments like antiviral drugs became the main tools. The end of the emergency, but not the virus. On May 5th, 2023, the World Health Organization declared an end to the global health emergency. COVID-19 was no longer considered a pandemic in the traditional sense, but the virus didn't disappear. It continues to circulate today, mutating into new variants and causing seasonal outbreaks, much like the flu by the end of 2023. The official death toll had reached 7 million. But experts estimate the true number is between 18 and 33 million. When accounting for unreported deaths, the economic cost was measured in the tens of trillions of dollars. But the social and psychological costs were immeasurable. An entire generation of children missed years of school mental health crises, skyrocketed anxiety, depression, and substance abuse surged. People lost faith in governments, scientists, and each other. Society became more polarized. Political and divided the legacy, a changed world. COVID-19 didn't just kill millions. It changed how we live. Work from home once. A rare perk became the norm for millions. Zoom became a household name. And remote work reshaped cities and real estate markets. Social distancing and mask wearing became symbols of political identity debates over vaccines, lockdowns, and government mandates tore families and communities apart. Trust in institutions, media, and science eroded. Supply chain disruptions exposed the fragility of global trade. Inflation soared as governments printed money to support economies. But COVID-19 also showed humanity's resilience. Scientists developed vaccines in record time. Communities came together to support each other, and healthcare workers became heroes. The pandemic reminded us that in a globalized world, a virus in one city can shut down the entire planet. It was a warning, a wake-up call, and a tragedy. But what if none of this had happened? What if COVID-19 had never emerged from that market in Wuhan? What if the world had never experienced lockdowns, economic collapse, and mass death? Let's imagine that alternate reality. But what if December 2019 had gone differently? What if the virus never jumped to humans? What if COVID-19 never existed? Let's rewrite history. Families gather fearlessly. Businesses operate normally. No quarantines, no social distancing, no masks. The Huanan seafood market in Wuhan is open. Life goes on, and the world never knows how close it came to disaster. But what would this world look like 3 years from now, in 2023? How different would our lives be without this generation-defining pandemic? Let's explore how COVID-19 has profoundly changed our world, and what we would have kept and lost if it had never happened. Millions of lives saved the human cost. COVID-19 killed over 7 million people officially, but the true death toll is estimated between 18 and 33 million when accounting for unreported deaths. In a world without COVID-19 and all these people alive, grandparents who died alone in nursing homes are still with their families. Young people who succumb to the virus, despite being healthy, continue their lives. Healthcare workers who died, treating patients, go home to their families every night. The grief that touched nearly every family on Earth never happens. There are no mass graves, no refrigerated morgue trucks, no heartbreaking stories of people dying on ventilators, unable to say goodbye to loved ones. There are no COVID orphans, children who lost parents or caregivers. An estimated 10 million children worldwide lost a caregiver to COVID-19. In this alternate world, these families remain intact beyond deaths. The millions who suffered from long COVID, a debilitating condition causing chronic fatigue, brain fog, and organ damage, never experienced these symptoms. People who would have been disabled for years or permanently remain healthy and productive. The human cost of COVID-19 was staggering, and in a world without it, millions of lives continue uninterrupted. No economic collapse, a thriving global economy. The economic devastation caused by COVID-19 was unprecedented. In April 2020 alone, the United States lost 20 million jobs. The global economy contracted by trillions of dollars and entire industries collapsed. But in a world without COVID-19, none of this happens. The Great Lockdown never occurs. Businesses remain open. Workers keep their jobs and economic growth continues steadily. The $16 trillion in economic losses that the U.S. suffered never materializes globally. The tens of trillions of dollars lost to the pandemic remain in the economy. Stock markets don't crash in March 2020. Governments don't have to print massive amounts of money to support their economies, which means inflation doesn't surge in 2021 and 2022 the way it did in our timeline. Small businesses, the backbone of most economies, don't close permanently. Restaurants, bars, gyms, and shops that went bankrupt in our world continue to thrive. Workers, especially those in low-income service jobs, don't lose their livelihoods. The unemployment rate stays low, and economic inequality doesn't widen. As dramatically as it did during the pandemic, supply chains remain intact. There are no shortages of computer chips, cars, or consumer goods. International trade flows smoothly, and the cost of living remains stable without COVID-19. The global economy in 2023 is significantly stronger, wealthier, and more stable. No lockdowns. Freedom of movement continues. One of the most defining features of the COVID-19 pandemic was the lockdown for months. Billions of people were confined to their homes, unable to work, socialize, or travel. Governments imposed curfews, closed borders, and enforced social distancing. But in a world without COVID-19, lockdowns never happen. People continue to move freely. Cities remain vibrant, streets are full, and public spaces are alive with activity. There are no empty airports, no closed restaurants, no boarded-up storefronts. Life continues as normal international travel remains unrestricted. Tourism industries in countries like Spain, Italy, Thailand, and the Caribbean continue to thrive. Millions of people who lost jobs in hospitality and tourism keep working. Students attend school in person. There are no Zoom classes, no school closures, and no learning loss. An entire generation of children doesn't miss years of critical education and socialization. Young people don't lose formative experiences. Graduation ceremonies, weddings, and celebrations happen as planned. Mental health doesn't suffer the way it did. Isolation, loneliness, and the trauma of the pandemic led to skyrocketing rates of anxiety, depression, and suicide in our timeline. But without COVID-19, these mental health crises are far less severe. People maintain social connections, support networks, and a sense of normalcy. No remote work revolution, a different work culture. One of the most significant changes caused by COVID-19 was the shift to remote work. Almost overnight, millions of office workers began working from home. Companies like Zoom, Microsoft Teams, and Slack became essential. Zoom's stock price skyrocketed, and remote work became the new normal by 2023. Many companies adopted hybrid models, and some went fully remote. This reshaped cities as people moved away from expensive urban centers to suburban or rural areas. Real estate markets shifted and downtowns emptied. But in a world without COVID-19, this revolution doesn't happen. At least not as quickly. Remote work existed before the pandemic. But it was a niche perk, not a widespread practice without the forced experiment of lockdowns. Companies don't discover that remote work is feasible. Most people continue commuting to offices every day. Cities remain economic and cultural hubs with bustling business districts. Office real estate doesn't collapse, and downtown restaurants, cafes, and shops continue to thrive. This has trade-offs. On one hand, workers don't gain the flexibility and work-life balance that remote work offers. Commutes remain long and stressful, and people spend more time away from their families. On the other hand, urban economies remain strong, and the sense of community that comes from in-person work is preserved. The long-term economic and social impacts of remote work, both positive and negative, never fully materialize. No vaccine breakthrough, delayed mRNA technology. One of the few silver linings of the COVID-19 pandemic was the rapid development of mRNA vaccines. Pfizer, BioNTech, and Moderna created vaccines in record time using groundbreaking mRNA technology. This technology had been in development for decades, but COVID-19 provided the urgent funding and regulatory fast-tracking needed to bring it to market. mRNA vaccines proved not only effective against COVID-19, but also hold promise for treating cancer, HIV, and other diseases in a world without COVID-19. This breakthrough is delayed. RNA technology continues to be researched, but without the urgency and funding of a global pandemic, it progresses more slowly. The infrastructure for rapid vaccine development and distribution that was built during COVID-19 doesn't exist. Governments, pharmaceutical companies, and scientists don't collaborate at the unprecedented level they did in our timeline. This means that when the next pandemic inevitably arrives, whether it's a flu strain or another coronavirus, the world is less prepared. Vaccines take longer to develop and distribute, and more people die. The irony is that COVID-19, as devastating as it was, also prepared humanity for future pandemics in a world without COVID-19. That preparation never happens. No political division, a less polarized society. COVID-19 became one of the most politically divisive issues in modern history. Debates over lockdowns, masks, vaccines, and government mandates tore families apart and deepened political divides in the United States. COVID-19 became a partisan issue, with Democrats and Republicans taking opposing stances on public health measures. Trust in government, media, and scientific institutions eroded. Conspiracy theories flourished, and misinformation spread rapidly in a world without COVID-19. This specific source of division doesn't exist. Political polarization still exists, of course, but it's not intensified by pandemic-related conflicts. Families don't argue over vaccines or masks. Social media isn't flooded with COVID misinformation, and trust in institutions remains higher. Without the pandemic, people aren't forced to choose between public health and personal freedom. A debate that defined much of 2020 and 2021. Governments don't impose mandates that many viewed as authoritarian. And there's no backlash against public health officials who became targets of anger and even violence. The culture wars that raged during the pandemic over masks, vaccines, and lockdowns never happen. This doesn't mean society is perfect. But one major source of division and trauma is removed. No supply chain crisis, stable prices in our timeline. COVID-19 caused massive disruptions to global supply chains. Factories closed, ports backed up, and shipping containers piled up, leading to shortages of everything from computer chips to toilet paper. These disruptions contributed to the inflation surge of 2021 and 2022. As demand outpaced supply, prices for goods and services skyrocketed in a world without COVID-19. Supply chains remain stable, factories operate normally, and goods flow smoothly across borders. There are no chip shortages affecting car production and electronics. There are no empty shelves in supermarkets, and there are no delays in shipping. Inflation remains low and controlled without the pandemic-induced supply shocks. Central banks don't have to raise interest rates aggressively to combat inflation, which means the cost of borrowing for homes, cars, and businesses remains low. Economic stability is maintained, and consumers don't face the financial stress that characterized 2022 and 2023 in our timeline. No digital transformation, a slower tech revolution. COVID-19 accelerated the adoption of digital technologies. E-commerce exploded as people shopped online instead of in stores. Telemedicine became mainstream as patients consulted doctors via video calls. Digital payments, contactless transactions, and QR codes became standard online. Education platforms grew rapidly, and Entertainment shifted to streaming services. Companies that were already digital first, like Amazon, Netflix, and Shopify, thrived while traditional brick-and-mortar businesses struggled in a world without COVID-19. This digital transformation still happens, but much more slowly. E-commerce grows, gradually, not explosively. Telemedicine remains a niche service, not a mainstream option. Brick-and-mortar retail remains dominant, and shopping malls don't face the accelerated decline they experienced during the pandemic. Traditional industries have more time to adapt, and many businesses that went bankrupt. In our timeline, due to their inability to pivot to digital models, survive this slower transformation has pros and cons. On one hand, it preserves jobs in traditional industries and maintains a balance between digital and physical commerce. On the other hand, it delays the efficiency and convenience that digital technologies offer. The tech giants don't consolidate power as quickly, and the gap between digitally advanced and traditional businesses doesn't widen as dramatically. A world unprepared for the next pandemic. One of the darkest ironies of a world without COVID-19 is that humanity remains unprepared for the next pandemic, and there will be a next one. Pandemics are a natural part of human history. The Spanish flu of 1918 killed 50 million people. The Black Death in the 14th century killed half of Europe's population, and scientists warn that future pandemics are inevitable. COVID-19, as terrible as it was, taught humanity valuable lessons. It exposed weaknesses in healthcare systems, highlighted the importance of pandemic preparedness, and led to investments in vaccine technology, disease surveillance, and international cooperation. In a world without COVID-19, these lessons are never learned. Governments don't stockpile medical supplies, don't invest in pandemic response infrastructure, and don't prioritize public health funding. The World Health Organization doesn't receive the attention and resources it did in our timeline, and global cooperation on health issues remains weak. When the next pandemic arrives, whether in 2025, 2030, or 2050, the world is caught off guard just as it was with COVID-19. The response is slower, the death toll is higher, and the economic damage is greater. COVID-19, for all its horror, was also a wake-up call. In a world without it, humanity hits the snooze button. The year 2023 in an alternate timeline. What does the world look like in 2023 if COVID-19 never happened? People go about their lives without masks, without social distancing, and without the lingering trauma of the pandemic. Offices are full. Schools are packed, and public spaces are crowded. The global economy is stronger. Unemployment is lower, and inflation is under control. Families are intact. Millions who died in our timeline are still alive, celebrating birthdays, weddings, and holidays with their loved ones. Cities are vibrant, tourism is booming, and international travel is as common as it was in 2019. But this world is also less resilient. RNA vaccine technology is years behind pandemic. Preparedness is weak, and society hasn't confronted the fragility of global supply chains and healthcare systems. Remote work is rare, and workers haven't gained the flexibility they enjoy in our timeline. Digital transformation is slower, and traditional industries remain dominant. Politically, society is less divided over pandemic-related issues. But the underlying polarization still exists, just focused on different topics. The question is, would this world be better or worse than ours? Would it be better or worse? The impossible question on the surface. A world without COVID-19 seems unquestionably better. 7 million people are alive, the economy is stronger, and people are happier. But the deeper question is more complex. COVID-19, for all its devastation, also drove progress. It accelerated. Technological innovation proved that vaccines can be developed in months, not years, and forced society to confront inequalities in healthcare and economic systems. It also showed that governments can take bold action in a crisis, and that global cooperation is possible if imperfect. A world without COVID-19 is richer and more populous, but it's also more complacent, less prepared, and slower to innovate. It's a world where life continues uninterrupted, but also a world where humanity doesn't learn the hard lessons that could save millions of lives. In the next pandemic, there's no easy answer. This alternate world is better in many ways, but it's also more vulnerable. The question is, would you trade the progress and resilience gained from the pandemic for the lives lost and the suffering endured? Inclusion. The pandemic that changed everything. COVID-19 was one of the defining events of the 21st century. It killed millions, devastated economies, and changed how we live, work, and connect with each other. But it also showed humanity's capacity for resilience, innovation, and cooperation in a world without COVID-19. Those millions of lives are saved, economies thrive, and people are free. But humanity also remains unprepared for the next crisis. The lessons learned, the technologies developed, and the global awareness of pandemic threats never materialize. The reality is that COVID-19 happened, and we can't change that. But we can learn from it. We can honor those who died by building a more resilient healthcare system. By investing in science and by preparing for the next pandemic, we can take the progress we made and use it to create a better future. The pandemic stopped the world, but it also showed us what we're capable of when we work together. And that's a lesson we can't afford to forget. Don't forget to like, comment, and subscribe for more thought-provoking alternate history scenarios, exploring the moments that shaped our world.